Hello, welcome all. The chapter we are now going to discuss is reproductive health. What is reproductive health? Health in all aspects of reproduction. That's all. Simple definition. So, reproductive health means simple, healthy reproductive activities. But correctly speaking, reproductive health include some other aspects also, like emotional, social, and reproductive aspects. So, WHO has issued a correct definition, apt definition, in which it says that reproductive health means a total well-being in all aspects of reproduction. That is in physical, emotional, behavior, and social. In all aspects of reproduction, we should have a very healthy condition. The society should also have a healthy reproductive condition. In all aspects of reproduction, you should maintain a healthy situation. And India is one of the countries in the world who has proclaimed that attaining a total reproductive health is one of its social aims, social goals. And to achieve this, Government of India started programs under the banner family planning. In 1951, Government of India started family planning programs, and they have been doing many works to achieve this aim for that past so many decades, and has improved the condition, of the society altogether. But still, we have to achieve more. They have changed the program from family planning program. They have changed to family welfare program. And now it is under RCH, Reproductive and Child Health Programs. Government is doing a lot of work. In two ways, government wants to achieve this goal. What are the two ways? One, to make public aware of the situation. So, it is to make public aware of the situation. And two, providing facilities. So, these are the two ways government is supporting the program and trying to achieve the goal. How the government is making people aware of the programs? See, they are having a number of programs through audio, visual and print media. Government is giving information to the public. Then parents, other close relatives, teachers and friends, they are also given education regarding the need of achieving a social, healthy, reproductive society, so that from them the information will be passing to every member of the society. 2. Then 3. Introduction of sex education in schools. They are all engaged. So, they are all engaged because through this introduction of sexual education, school-going children will be having a chance of scientifically understanding the truth, so that they will never believe in myths, false beliefs. So, discouraging children from believing in myths and having misconceptions about sex-related aspects. Okay. It is with this aim that the government has introduced sex education in schools and educational institutions. Now, they are also giving information to adolescents who are in the adolescent age group to lead a reproductive healthy life. What information they are all given? Proper information about reproductive organs, okay, adolescents and related changes, safe and hygienic sex practices, sexually transmitted diseases, AIDS, etc. These informations are given to adolescent people, that is, who have gone out of school, okay, who has almost completed their school education. Similarly, they are also educating couple in the marriageable age as well as people in the marriageable age, fertile couple and those in the marriageable age, about the availability of birth control applications and options, carrier of pregnant mothers, how you should care the pregnant mothers, postnatal care of the mother, child, importance of breastfeeding, equal opportunities for the male and female child, etc. So, why they are given such information to fertile couple, newly married couple, and those who are in the marriageable age? Because that will be addressing the importance of bringing up social consciences among families of and bringing aware of the importance of having a small family norm among the public. Also, we are all giving informations to them to become very responsible persons and citizens, to understand the problems of the country and the society as a whole, and have a contribution in making a healthy society. So, such persons are given opportunities to have any awareness, to have a knowledge on such problems. Okay. They should bring up the children in a healthy way. They should be given education. They should be allowed to go to school, and they should be also aware of social evils like sex abuses, sex-related crimes, etc., etc. So, these are the ways in which government is trying to bring awareness among the public. That is one way. One way. Second way, I told you that there are two ways in which government is trying to make public aware of. Government is having two-way actions. One is making public aware of. So, awareness. Two, government is providing facilities. Successful implementation of various action plans to attain reproductive health requires strong infrastructure facilities. So, the government is trying to have more and more within the nation, they are all producing facilities, strong facilities, infrastructural, meaning you should have more hospitals, a hospital at least in every panchayat, well connectivity, ambulance services, etc. That is infrastructure. Professional expertise. There should be available number of doctors should be increased, nurses and health workers. They should be made available. So, such professional trained expertise should be there. And three, material support. Government is providing medicines and all other facilities to treat people if they become sick. So material support. These are essential to provide medical assistance and care to the people in reproduction related problems. What are these problems? Pregnancy. So every hospital should be there in a village or in a panchayat so that the carrying mothers can go there and can have assisted deliveries, medically assisted deliveries. Pregnancy, delivery, STD, abortion, contraception, menstrual problems, infertility, etc. These problems in the society can be addressed and can be contained then and there itself. Government is also taking statutory measures. It is imposing laws and rules. That's why government has banned amniocentesis because people have been misusing it. What is amniocentesis? It is actually a prenatal test to detect whether the developing baby can have a genetical defect or not. If the baby is found to be having a genetical defect, better you can avoid that baby by having an MTP. That was the aim of amniocentesis. A small amount of amniotic fluid is taken using a small syringe, and the cells present in that amniotic fluid is karyotype. Its chromosomes are studied, and based upon the studies, we can know whether the baby can have any chromosomal anomaly and thereby having a metabolic defect or a genetical disease for which there is no remedy. If the baby is found to be having such a defect, then better do an MTP. It is better not to have such a child because such a child will be a burden to the family. So better avoid it. That was the aim. But people began to abuse it. What is abuse? Using it for abnormal, unwanted causes or reasons. People began to get female feticide through this amniocentesis. When they find that it's a female girl, it's a female child, female fetus developing, they will opt for an abortion. Thus, female feticide people are doing. So that is an abuse. Its correct use is for detecting chromosomal anomalies in the developing baby. But people were abusing for detecting the sex and female feticide. So government has banned. This procedure is used to test for the presence of certain genetic disorders such as Down syndrome, trisomy, hemophilia, sickle cell anemia, etc., which will determine the survivability of the fetus. But people were abusing it. So government has banned, statutory ban on amniocentesis. Okay. Now, researchers on various reproduction-related areas are encouraged and supported by the governmental and non-governmental agencies. Government is not trying to implement all its own, but also is taking the help from non-governmental agencies, NGOs, etc. Because it's a social problem. So we should take help from whatever organization can support them. So government has taken support from. A classical example for that is that the very common contraceptive pill called Saheli. We'll be now studying about Saheli in detail. That Saheli was developed by a drug manufacturing research organization, namely scientists of Central Drug Research Institute, CDRI of Lucknow. So their main function is to produce newer and newer varieties of medicines for treatment, but they also help the government to achieve this by producing a magical pill by name Saheli. Okay, the government is taking the help of even non-governmental organizations, NGOs, that is NGOs, as well as other agencies who can support the government in achieving the social goal. Okay, now let us see why the government is very much worried about the population growth. The population growth is alarming, both in the whole world scenario as well as in India. The situation is same. See, the world population was just in 1900. The world population was just 2 billion. In 1900. Now, in 100 years, that is in 200, it rose to 6 billion. It tripled 3 times in just 100 years. Now, the population is 7.2 billion as per the 2011 census. It is 7.2 billion. In the same condition in India, what is the condition? In 1947, when we got independence, we were only 35 crores. We were only 350 million. 350 million is 35 crores. Okay, 350 million. Now, in 2000, it crossed 1 billion. 1,000 million. From 350, it rose to 1,000 million. 1,000 million is 1 billion. So, in just 53 years, our population also almost tripled. In 2011, the population is 1.2. In 2011, it is 1.2 billion. The world population in 2011 is 7.2 billion. So, world population as well as India population is growing very fast. Though government was trying all its might to control this social menace of population explosion, still our population growth rate is less than 2%. That is, for every 1,000 person in 1 year, 20 persons are newly formed. Almost less than, slightly less than 2%. That is the rate at which our population is still growing. So government thinks that if our population is growing in this way, there will be no sufficient space for the people to make their home, to have agriculture, so food, shelter and other necessities will become very, very acute in our country. So it is causing absolute scarcity of even this basic requirement like food, shelter, clothing. Even though we are all making progress economically, these progresses will be nullified by the huge population that is continuously growing. That is why the government has been forced to take up serious measures to contain this population growth, to check the population growth. Okay, so as the population is growing enormously, we are all facing a severe problem. Our population is exploding. And if this population growth is not checked, in short time, there will be acute shortage of food, shelter, and clothing. So, government was forced to take strict measures to contain this population growth. Now, what's the main reason for this? There was a rapid decline in the death rate of mother following delivery, maternal mortality rate, and infant mortality rate. That is, babies within the age of 1, they are not dying because we have improved our social and healthy standards. So, there was a decline in the maternal mortality rate and infant mortality rate. That's number one reason. There is an increase in the number of people in the reproductive age. More and more people are entering into the reproductive age. So, these are the two reasons why our population growth is increasing. How we can overcome this problem? We have to accept small families norms. Using various contraceptive measures, we have to control our family size. And for that, government is doing everything possible. That's why government has popularized the slogans like Hum do, Hamara do, we two. Okay, ours two, only 2 children. So this slogan has been popularized, but only the urban and educated people have accepted. This message has not been accepted and adopted by many rural folks. So this message is to be reached each and every fertile couple, adult individual of our country, and thus government is making it more and more popular. Number 2, government has statutorily, that is by law, raised the marriageable age of women to 18, girls to 18. Before that, no girl can enter into married life, and for men, males to 21 years. So, statutory raising of marriageable age of female to 18 and that of males is just done to reduce the number of children that may be produced by a couple. Okay. And couples are encouraged to adopt small family norms for which they can use contraceptive measures. Why people should use or adopt contraceptive measures? Because by that they can prevent unwanted pregnancies. That is the main aim of using contraceptives. What is a contraceptive? Any device or mechanism or method that will be preventing pregnancy, it is contra against conceiving, that will stop conceiving pregnancy, is called a contraceptive. There are so many different types of contraceptives. Each one will be having its own working principle, and everybody can adopt these types of contraceptive measures depending upon their requirements. So, we are all making the basic principles of these contraceptives available for the young children like you, because you understand the basic principle of them, so that you can spread this message to others and also you can adopt it in future. So, first method, we are having natural method or traditional method, then barrier method, IUDs, oral contraceptives, injectables, implants, and surgical methods are the most important types of methods of contraceptives. What are the good qualities a contraceptive should have? See, a contraceptive should have certain principles, then only public will accept it. One, it should be user friendly, easy to use, easily available. Number two, it should be very effective in controlling or preventing pregnancy, and it should be reversible. That is, when the couple wants to have a child, they can come back to normal reproductive life. So that's what's called reversibility. When you use that contraceptive measure, there will be no conceiving. But once you stop that device, you should have reproductive activities like pregnancy occurring. Okay. And last one, it should have no or very minimum, least side effects. Then only people will accept it. A contraceptive should not interfere with the sexual drive or desire or sexual act of the user. Okay, so these are the qualities a good contraceptive, an ideal contraceptive should be having. Now let us study one by one these techniques. Natural method work on the principle of avoiding chances of ovum and sperms meeting. That is the working principle. They will be avoiding the chance. We are not giving a chance for the sperm and ovum. See, only when there is a chance of a sperm meeting with an ovum, there will be fertilization. And only if there is fertilization, there will be pregnancy. Suppose you are not giving a chance for meeting sperm and ovum, then it is called natural method. There are different types of this natural method. One, we are having periodic abstinence. We know that menstrual cycle is a cyclical event lasting for, say, for example, 28 days. And it is on the 14th day ovulation is occurring. And the ovum will be living for about 2 to 3 days. So, if the couple are engaged in coitus, mating, there are abstaining from coitus on day 10 to day 17. 3 days earlier, 3 days after. Then the chance of fertilization is almost nil. Because it is on the 14th day that normally ovum is produced and ovum will be live for 2 to 3 days. So when couple are engaged in coitus on such days, the chance of pregnancy is very high. So we call it as risky days. It is risky days. Okay. And first 5 days, that is menstrual day, and day 6 to 10, it is comparatively safe. So this is also called safe period. It is comparatively safer on day 5 to 10 and 17 to 28. That is called, so it's called safe period. The couple should engage in sexual act only in safe period days and abstain from day 10 to 17. So, periodic abstinence, abstaining from sexual act on such days. Okay. Another one, which is the oldest method, it is called coitus interruptus or withdrawal. It is another method in which is very simple. The male partner will be withdrawing his penis from the vagina just before insemination. He is not inseminating release the sperm inside the female genital tract. So he is withdrawing. Coitus is abruptly stopped, interrupted just before ejaculation. And third method is lactation amenorrhea. This technique will be effective only for a mother who has already delivered, because after delivery she will be having intense lactation, and that lactation, that milk will be having an inhibiting factor that will be suppressing development of a new follicle. So there will be no menstruation, and as long as there is no menstrual cycle, there is no ovum developing, that is the absence of menstruation. So as long as the mother is lactating, there is less chance of a new ovum released. So persuade her to have breast feeding to her baby, so that there are two benefits. The baby is getting the best food in the world. Number two, she is having protection from having another pregnancy immediately after that. But there's a problem. This method will be effective only for a lactating mother. Okay. And this is also effective for a maximum of 6 months. Because after that, the milk quantity decreases and the effectiveness of that inhibition will be also decreased. Second method is barrier method. What is the action of this barrier method? Barrier method will be physically preventing. That is the action. It is physically preventing the meeting of gametes. It acts as a barrier so that sperm and ovum are not at all meeting, because there is a barrier. So what is that barrier? It may be a condom. Condoms are for both males and females. Condoms are having some advantages. Because of the condom, the male and female sex organs are not coming in physical contact, so they will be giving protection against contraction of STDs. Number two, condoms can be used by the users. Just before coitus, the male will be covering his penis with male condoms, and female will be placing this female condom inside her vagina. So the semen will not be released to the genital tract. That is the principle. The semen released will not be entering into the female genital tract. It is trapped in the bag, which is made up of a sac, which is made up of thin rubber or latex sheath. Condoms are for both males and females, and it is single use. Okay. Since condoms can be used by the user themselves, it gives also privacy to the user. That is yet another advantage of using condoms. Now, second method is balls, caps, diaphragms, etc. These are all only for female. They are made up of thick rubber. They are to be inserted into the vagina just before coitus, so that it covers the cervix. It covers the cervix. So no sperm can enter. This is the uterus, this is the cervix, this is the vagina. Okay. Now, we are all keeping these barriers here. It may be of different sizes and shape. That is why we call it as caps, balls, etc. So the sperms are released here. It cannot enter into the cervix. So physically preventing the entry of sperm into the cervix. They are all reusable. And the advantage is that we can use forming gels, creams, tablets, etc. These tablets, gels, etc. will be inserted into the vagina. They are to be inserted into the vagina just before coitus, and that will be forming a thick lather, a form. And in that form, the sperms are trapped so that they will not have the ability to swim and they will never reach the ovum or the fallopian tubes. Okay, that is the principle behind using of spermicidal creams, jellies and foams. They can be used along with the condoms. Now, a very effective method is IUD, intrauterine. This is also for only females. This is to be placed inside the uterus. So for that, we have to take the help of a doctor or a trained nurse. We cannot insert it or take it out directly. But it is very effective and gives long-term protection. As long as that IUD is inside the uterus, the mother will be getting protection from getting pregnant. Okay, we are having the IUD, which are all working based upon that principle. What is that principle? It increases the phagocytosis of the sperms. So sperms that are passing through the uterus will be trapped and eaten away, phagocytized by the cells lining the uterine wall. That is the principle of IUD. Okay, we are having three types of IUDs. One, non-medicated IUD, Lippis loop. Lippis loop is simply a cold plastic structure whose shape is similar to that of the matching with the cavity within the uterus, and once this foreign material is introduced, that will be having some effect on the uterine wall, so that uterine wall will be having increased phagocytosis. Okay, a foreign body is introduced, that will be causing an irritation in the uterus, so uterine wall will be having increased phagocytosis. Second one is copper releasing. What is that copper releasing? CUT, CU7, multi-load, etc. What is the action of copper? Copper releasing IUDs will release small amount of copper ions throughout their life. See, they will be having 3 to 5 years of lifespan. When such a device is introduced, they will be releasing copper ion. This copper ion suppresses sperm motility. So sperms become immotile and they cannot reach the ovum. Third one is hormone releasing IUD. Hormone releasing IUD will be releasing small amount of progesterone, artificial progesterone like levonorgestrel. So progestasat LNG20. What is the action of this hormone releasing IUD? The hormone releasing IUDs are having one additional advantage. What is that additional advantage? Let us see. It will be making the uterus unsuitable for implantation. So even if fertilization occurs, implantation is not possible. So it makes uterus unsuitable for implantation and will make the cervix hostile to sperms. So no sperm passage occur through the cervix smoothly. The sperms that are passing through the cervix will be trapped and destroyed. And even if a sperm succeed in overcoming these obstacles and reach and fertilize an ovum, the ovum cannot get implanted. The zygote cannot get implanted because the implantation is not possible. So, unsuitable uterine cervix become so modified that implantation is impossible. Okay. So, this IUD is a widely used method adopted by the women of India. Remember, this IUD will be having long duration. Okay. And this can be also used for delaying pregnancy, spacing children, etc. Space in children means after the first delivery, when you should have the second baby, 3 years, 5 years, etc. That can be also determined. So you accept an IUD, you insert an IUD, then as long as the IUD is there, there will be no conceiving. Okay. Then another method is pills. What are pills? Pills are those which are all taken through the mouth. What are these pills? These are all containing progestogens or progestogen-estrogen combination. What is the action of them? These progestogens are inhibiting ovulation and implantation. That is their action. They inhibit ovulation and implantation. They also alter the quality of the cervical mucus so that it will be preventing and retarding the entry of sperms. Normally, we are having two types of pills. One, daily pill, like Mala D, daily. This is a packet of 21 pills, and we have to take pill daily for a period of 21 days, starting preferably within the first 5 days of menstrual cycle. It should be started within the first 5 days. Before the menstrual flow is stopped, we have to start taking that. Okay. Then continuously take it. The packet is containing 21. So you continuously take it for 21 days, then stop it. After a gap of some days, usually 7 days, menstruation occurs. Again, you start another packet. So you go on taking the tablet daily. Okay. So it is also for females. But now we are having weekly ones. That is Saheli, the wonder pill, Saheli, a new oral contraceptive for females. What is the advantage? This is to be taken only once. So even if you forget to take today, you can take it next day. No problem. Once in a week. Second one, it is not at all containing any steroid. So there will be no side effects. It is not at all a hormone. So it will not be interfering with your normal metabolism. So it is a non-steroid, non-hormonal. Then what it is? It is an anti-implant. That's how it is acting. It is preventing implantation by bringing changes in the receptors in the mucal lining of the endometrium. It brings about changes in the endometrial lining. Thus, it prevents implantation. It is anti-implant. And the chemical it contains is called senchromen. Senchromen. That is the chemical ingredient. Okay. So, this is having wide acceptance. Then, we are also having implants. What is an implant? Which will be placed in your body for longer time. So, what is in that implant? This is the Norplant. It's an implant. It has 6 small tubes. Each one may be having, say for example, 6 milligram of LNG, levonorgestrel. It is having a combination of, normally it will be having progestogen alone, or rarely having progestogen along with estrogen. So just take the pill. Its action is similar to that of the pill because both are having progestogen or combination with estrogen. What is the advantage of that implant? Implant will be having longer effect. They may give you protection for 3 years to 5 years. It is placed just beneath our skin. Okay, on the arm, just above the elbow. And their mode of action is similar to that of the pill. And their effective period are much longer. That is the advantage. Now, We are also having emergency pills. What is emergency pill? Which is to be given only single dose. Suppose a girl was raped. Okay, a unprotected sexual act occurred. In the next day, that girl should be given one tablet. That tablet is called emergency pill, E-pill. That pill will be progestogen or progestogen estrogen combination, then IUD or both together. That should be given within 72 hours of sexual act, coitus. That is found to be very effective in preventing implantation. Already sexual act has occurred. Sometimes that may have resulted in fertilization. So fertilization already had occurred. But within 72 hours, suppose you are all giving that pill, emergency pill, which is containing either progestogen or progesterone combination plus an IUD, then implantation can be prevented. So unwanted pregnancy can be avoided. So this is to be used to avoid possible pregnancy due to rape or casual unprotected intercourses. And the last method is the surgical method. What is surgical method? By a small surgery, we are preventing the transportation of gametes. That is the working principle. We are interfering with the transportation. Transportation of gametes are made impossible. We are all blocking the transportation. That is by a small surgery. That's why it is called surgical methods. It is also called sterilization method. Why they are called sterilization methods? Because it is given to both male and females, and once males accept, he becomes sterile or she becomes sterile. Okay, so it's called sterilization method. Through a small incision in the scrotum, both vas deferences are cut. You know that sperms are transported through the vas deferens. So that is cut and both ends are tied so that they will never again rejoin. So there's a block in the transportation. This is called vasectomy for males. Okay. Similarly, through a small incision in the abdomen, you will be giving similar treatment to a woman. Her fallopian tubes are, see, very close to the uterus, are cut and tied so that the sperms cannot reach the ovum. And even if it reaches, the fertilized zygote cannot come and get implanted in the uterus. So transportation of gametes are prevented. Vasectomy in males and tubectomy in female. This is called a terminal method. Why? Because this is a very effective one. It is having very high effective level. But at the same time, there is a shortcoming. What is that? It is having no reversibility. Once a couple adopted, either male or female, adopted this technique, and after some years they want to have another child, they can never have. Because what change you have brought in the anatomy of the reproductive tracts, reproductive ducts, is a permanent one. So reversibility is absent. There is no reversibility. That is why it is called terminal method. And so this method can be adopted for or adopted by parents whose family is already finalized. That is why it is called a terminal method. Okay. Now, you have to understand that there are so many techniques and each one is having their own benefit, and at the same time they are all having their own side effect. A significant role in checking uncontrolled growth is possible is made by these contraceptive methods, but they will be also having some side effects like nausea, abdominal pain, breakthrough bleeding, that is irregular bleeding, irregular menstrual bleeding, or even breast cancer. These are all minor changes, but the doctors will tell you that these are all the common ones, nothing to be worried. They will be counseled before they accept the contraceptive measure. They should not be totally ignored. Okay. Also, one point you have to remember is that these contraceptive measures are not for achieving a social, healthy, reproductive activity, but they are all against the normal, natural, against a natural reproductive event, because conceiving, becoming pregnancy, etc. are normal, and these contraceptives are against that reproductive activities. But why we are all encouraging these contraceptives? Because by that we can plan our family, determine the number of children that we should have, a couple should have, and thus we can plan the size of the family. And the point we have to discuss is regarding the medical termination of pregnancy, MTP. Normally, naturally, there may be sometimes abortions. The baby may be expelled, either dead or alive, before completing the full term of gestation. That is called abortion. It can occur anytime, normally in the early stages of pregnancy. But here, it is intentional, deliberate. That intentional or voluntary, deliberate termination of pregnancy before the full term is called MTP, medical termination of pregnancy. In the whole of the world, we are having about 225 to 250 million. We are having 225 to 250 million pregnancies all over the world in a year, and out of that, 1/5, that is 45 to 50 million abortions are done. So 1/5 of the pregnancies are aborted all over the world. Government of India has legalized MTP as early as in 1971, as government thought that if people are willing to have an abortion, let them have it. Thereby, they may be having a family size controlled. But government has laid some strict norms, regulations. People will be again abusing it. For what? They think that a female child is a burden to the family, and so if they find that it's a female child developing in the uterus, they will get it aborted. So female feticide. To safeguard that, government has made strict regulations. What are these? MTP can be done only on social and humanitarian considerations, meaning suppose a girl was raped and she became pregnant, she should be given an MTP. Okay, so that is on social. Or when the couple who are all using contraceptive measures failed, so they should be also having a facility for MTP. And second one is on health conditions. If the continuation of the pregnancy is a health problem, is posing a problem for the health of either the baby or the mother or both. Continuation of the pregnancy is a grave situation it is affecting the health of the baby or mother or both, then also that is on health grounds, MTP is allowed. So it is only in these conditions that MTPs are allowed. Okay. And when it is to be done, it is safe to have MTP normally in the first trimester up to the 30th week of pregnancy. Because during this period, the implantation that had occurred very early, that will be resulting in the development of a placenta, the intimacy, and placenta is taking almost 10 to 12 weeks for completing its development. So if MTP is done within that period, the separation of the baby is not growing, baby has not grown to maximum, to the full size, so separation will be easy in the first trimester. Whereas in second trimester, abortions are more risky. Okay, so only in such conditions MTP are allowed. Okay, MTP is not MTP is not accepted in some countries of the world. Because of the religious as well as social situations, some countries have not allowed or accepted MTP. And next point is regarding sexually transmitted illness or diseases. It is also called sexually transmitted infections, okay, or venereal diseases or reproductive tract infections. What are these? These are all infections that are transmitted through sexual intercourses. So these are all diseases that are spreading through sexual interactions. We are having a number of diseases. That disease may be caused by some viruses. For example, we are having some diseases caused by viruses, genital warts and genital herpes. These two are caused by viruses. Okay. Then we are having bacterial diseases belonging to the gonorrhea, syphilis, chlamydiasis. Okay. These are all bacterial diseases. You also have protozoan diseases, fungal diseases. So the causative agent may be anything. Okay. But understand, some of the infections like hepatitis B and HIV, though they are all transmitted through sexual intercourse or sexual contact also, they are not affecting the reproductive organs. They are not affecting the reproductive organs. They will be easily spread through the body fluids. So, if you are all sharing injection needles, surgical instruments, etc. with infected persons, transfusion of blood, or from an infected mother to the fetus, these diseases like HIV and hepatitis B will be easily spreading. Now, these diseases are causing great problem to the society, and understand that hepatitis B and genital herpes and HIV infections cannot be cured completely. Whereas all other diseases like gonorrhea, syphilis, chlamydiasis, etc. can be completely cured. But still, these diseases are prevalent in the society. They are found in the society. Why? Because in the early stages of infection, symptoms are not at all that much significant, almost asymptomatic, and they will infect and cause very slight pain, fluid discharge, swelling, etc. And in females, they cause no other symptom. So they are all asymptomatic. So they may remain undetected. And only at the later stage, they become very virulent, they become more grave, and infected females will have more problems, and males will be having severe discharges and other problems. Okay. See, in the later stages, complication involves PID, pelvic inflammatory diseases. It may even cause abortions, stillbirth, ectopic pregnancy, that is pregnancy outside the normal position in the uterus, infertility, or even cancer of the reproductive tracts. Thus, it will be posing a great problem for the health of that individual. So, STIs are major threat to a healthy society. So, we have to prevent it early, and its detection, early detection and cure are given prime consideration under the reproductive health care programs. Normally, children of age group 15 to 24 are normally affected, because it is at this age group that they start experimenting with the sex, and so they are all having more chance of getting infection. But we have to take precautions. See, prevention is always better than cure. So how you can prevent the infection of an STI? One, avoiding sex with unknown partners or avoid multiple partners. Always use condoms during coitus. And if you are having a doubt of having a chance of infection, immediately, don't wait for the symptoms to appear, immediately go and consult only a qualified doctor. A qualified doctor, never go to a cox. So, go to a qualified doctor for early detection and get complete treatment if diagnosed with infection. Okay, so you are having hepatitis B, which is affecting our body, especially our liver. It is through the blood that they are spreading. Our whole body will be, it is through the body fluids that they become infected. Similarly, HIV through the body fluids, and these are commonly spreading by sharing of instruments used for taking injections, surgical instruments, etc. So we have to be very careful in these things. Okay. And coming to the last part, namely infertility. What is infertility? Suppose a couple is living together having free sex, that is called sexual cohabitation. Large number of couples of the world, including India, are infertile, meaning they are having no children, though they are all living together. Sexual cohabitation, meaning they are living together and having free sex. They have not taken any contraceptive measures. For more than 2 years, they have been living together. Still, they are not having any children. Then they are said to be infertile. There are so many reasons for this infertility. Okay, it may be physical reasons. It is because of the physical reasons. It may be congenital, right from birth, diseases, some other diseases, drugs that we may be using for treating some other diseases, immunological, or even psychological. So it is because of these so many reasons that normally you will be having infertility. So the reason for infertility may be sometimes unknown. What is the situation in India? Whenever a couple is having no child, immediately we will blame that the mother is responsible. She is not capable of having children. It is because of her. The whole society and the family will curse her. But understand that it may be equally because of a problem of the husband. So if you find that a couple is having no children, they are fertile, they should consult a doctor, qualified doctor, and fix what actually is the problem. So they should consult a doctor and take preventive measures. Sometimes it may be treated with a small medication, or sometimes a minor surgery will be helping them. So anyhow, they will be diagnosed, and corrective treatment of some of these disorders will enable them to have children. They will have children by taking such remedial measures. But sometimes even such corrections are not possible. Then they should be given what is called ART, Assisted Reproductive Technology. We have developed a number of techniques. Through the progress we made in the field of biotechnology, we have developed certain special techniques which are commonly called as assisted reproductive technologies to have them children. Okay, now how we'll be having that ART? Let us see. First of all, we have to identify with whom is the problem. The problem may be for the mother. What problem she may have? She may have two problems. One, she is not producing ovum, not ovulating. She is having no ability to produce ovum. Okay. Sometimes she may be ovulating, but uterus is not healthy. Uterus cannot support pregnancy. Why? Because uterus is not healthy enough to support pregnancy. There is no problem with her ovum. So it may be because of absence of eggs. Sometimes it may be because of a problem in the uterus. Okay. Or it may be both. So not only ovulating, but her uterus is also not normal or proper. In such conditions, suppose we have diagnosed and found that the problem is female and the problem is that she is not ovulating. She cannot ovulate. So we can take an ovum from a suitable donor. That gamete is taken and introduced into the fallopian tube of her. See, this is the fallopian tube. Her uterus is normal. She can conceive. So, you take the ovum from a donor. That ovum is the gamete. So, gamete is taken and introduced into the fallopian tube. That is called gift. Gamete intra-fallopian transfer. Okay. Now, she will be having normal fertilization. Okay. And the ovum will be implanted here and will be developing because her uterus is normal. So, by a gift, that is called a gift. Sometimes she is ovulating, but her uterus is not healthy to support. Then what should be done? We take that ovum out. In some special clinics called fertility clinics, we are having that facility. induce her to have ovum, and these ova are all taken to the laboratory conditions, and in that laboratory condition, which is similar to that of the condition in the fallopian tube, allow to have fertilization. The ovum is taken and now it is mixed with the suspension, sperm suspension of her husband. So you will be having what is called in vitro fertilization. In vitro fertilization. So we are providing the same condition as is present in the body, in the female body. So if you are providing the same condition in the laboratory, the sperm will be meeting with the ovum and will be effecting fertilization. Now, our uterus is not at all healthy to support. So what should be done? You have to prepare a surrogated mother. Parallelly, you have to prepare a surrogated mother who will be receiving and carrying her baby for her. So surrogated mother. And if it is up to 8 cell stage, we can transfer directly into the fallopian tube. So fallopian tube here to that surrogated mother, you are all directly. So here we are transferring the zygote. Zygote is transferred into the fallopian tube. So we call it as fifth zygote intra-fallopian transfer. Only up to 8 cell stage we can do it. If it is after 8 cell stage, you cannot transfer directly to the fallopian tube. It is to be transferred into the uterus because it has become an embryo and is ready for implantation, and so it is to be transferred into the uterus directly. So it's called intrauterine transfer. Okay. So this can be done if her uterus is not healthy to support a pregnancy. Sometimes she will be ovulating and she will be also having healthy uterus. But anyhow, there is no pregnancy. Then there is no need of a surrogated mother. You perform an in vitro fertilization. You take that ovum and fertilize it in the laboratory condition and give it to the same mother, uterus or fallopian tube. There is no need of a surrogated mother. Either fallopian tube, that is up to 8 cell stage, or if it is after 8 cell stage, you can directly pass to the uterus. Okay. There is no need of a surrogated mother. Okay. Now, see that the problem is with the husband. Situation is changed. What is the problem? One, he cannot inseminate. There is no sperm at all. He is having asthenozoospermia. No sperm at all. He cannot inseminate. Okay, so cannot inseminate. Then what should be done? You can receive sperm from a donor. And inject it, artificially inject, artificial insemination. Artificial insemination. Either to the uterus intrauterine insemination. It can be done directly by injecting the uterus or to the vagina. Okay, so sperm from a donor is taken and it is transferred. Suppose the husband is producing very few sperms. The problem is that the count is very less, or the sperms are having no motility. Sperms are produced, but they have no motility. Remember that for effective fertilization, there should be sufficient sperm count. Okay. 60 to 80 million per ml of semen. That is normal sperm count. Out of that, 60% of them should be having normal size and shape and structure, and 40% should have vigorous motility. Now, the problem is with the motility of the sperm. So what can be done? You take the ovum from the mother out in the laboratory condition, and you can directly inject the husband's sperms through a micropipette. Under microscope, you observe it. And this is called intracytoplasmic sperm injection. Sperm cannot move and reach the ovum by itself. So you give an assistance. You take that suspension, sperm suspension, in a micropipette or in a syringe and directly inject into the cytoplasm of the ovum. So here also we are all performing in vitro fertilization. In vitro fertilization you are all performing. Now, if the ovum is fertilized, it starts developing and that embryo can be given back to the fallopian tube or to the uterus of the wife. So, we are having the sperms of the husband artificially injected into the cytoplasm. Okay. Here, we took it from a donor, but here we took it from the same husband. There is no need of a donor. Okay. So, we can have intracytoplasmic sperm injection if the problem is with the motility or very low sperm count. Only very few sperms are available. Still one or two. See, for effective fertilization, one sperm is sufficient. So, you select only the healthy sperms of the husband itself, so that the husband and wife are their biological parents also. Here, the biological parent, husband, is not the biological father of that baby, because we have taken the sperm from a donor. So that is the difference. So here, we will be having in vitro fertilization, and after in vitro fertilization, take the zygote back to the uterus. Clear? So, in vitro fertilization followed by embryo transfer. IVF ET is simply called as test tube baby programs. They are called test tube baby program. And it was in 1978 we had the first baby, test tube baby born in this world. Thereafter, we are having this technique widely occurring. Louis Gilbert Brown. Okay. So, if it is up to 8-cell stage blastomere, it is directly transferred to the zygote. So, zygote intrafallopian. If it is after that, it is IUT. That transfer of ovum collected from a donor into the fallopian tube, that is called gift. Of another female who cannot produce one but can provide suitable environment for fertilization, meaning she is not at all ovulating, but her uterus is normal and healthy. Intracytoplasmic sperm injection, ICSI, to form an embryo in the laboratory So it is in laboratory, in vitro fertilization, in which a sperm is directly injected to the ovum. Infertility cases, either due to inability of the male partner to inseminate the female or due to very low sperm count in the ejaculate, can be corrected by artificial insemination, where we are taking the semen collected from a husband or a healthy donor, artificially introduced into the vagina or to the uterus. But remember that these are all very expensive, and these facilities are not available everywhere. Okay. Sometimes you may have to spend years together in the hospital. Very often that will be resulting in good positive, whereas sometimes it may not even succeed. The result is not encouraging sometimes. So it is incurring loss of time, loss of money, etc. And it need not always be successful. So what is the best remedy? Parents can adopt a child legally, because in country like India, where you are having a number of orphanages, we can legally adopt a child. By legally adopting a child, you achieve two things. One, you become the parents of that child. Two, the child is getting a better living conditions. You will be giving good education, good food, and healthy environment for the baby to grow. So the baby is getting a bright future. You are also becoming parent of that child. So it is easy to adopt a child. Okay. Legally, that our law permit legal adoption, and as yet one of the best method for couple looking for parenthood. And with that, I conclude the discussion of this chapter, and I hope that it is very much interesting to all of you. I am winding up my discussion, and will meet with another chapter next time. Until then, take care and goodbye. So thank you all. Thank you very much.